Monitoring is viewed as a process that provides information and ensures that information is used by management to assess the project. It aims to determine whether or not the intended project objectives are met. As such, one might consider the primary objective of monitoring to be facilitation of mid-course corrections to the program in order to improve its efficiency. But what does that mean practically? Well, first, it means that monitoring is usually routine and regularly scheduled. It also means that we want to measure and assess performance and to make adjustments to the type of care we provide and the method in which we provide it. Here, I want to make an important distinction. We're monitoring the performance of our program and not the performance of individuals. And we're monitoring the performance of the program with the goal of improving performance so that we can ultimately move more effectively and efficiently towards the desired outputs and outcomes. To do this, we need to collect accurate information and use that information. And this needs to happen on a regular basis. We want to highlight the importance of capturing accurate information. This is important not just for program monitoring, but also for ensuring good patient care. Accuracy is comprised of two key elements, reliability and validity. Reliability refers to getting the same information each time. That is, 10 different clinicians doing a TB symptom screen will come to the same decision for a particular patient at a particular time. Or each data encoder will extract the information from the patient file in the same way. Validity refers to whether or not the information is correct. That is, a patient with rifampicin negative gene expert result is a true rifampicin resistant TB case, or that an X indicates that a patient received a test instead of an X meaning that a test was not performed. Some information we capture will be reliable but not valid, while others are reliable or valid but not both. In practice, we want to hit the bullseye and capture information that is both reliable and valid. When we are working as clinicians and we capture a piece of information as part of good medical record keeping, for example, a patient's weight, we use that information to inform our care, for example, to determine medicine dosage or to monitor a patient's health status over time. The same principle applies to program monitoring, except that we want to use the information at the program level. If, for example, we see poor outcomes among our patients, and then through a file audit and further analysis, we see that our patients have poor nutritional status, we may look into offering a training on nutrition among our clinicians, or introducing a food program for our DRTB patients, or actively linking our patients to other actors who provide nutritional services. To achieve this, everyone should be involved and feel accountable to the process of collecting and using our program monitoring data. Good program monitoring starts with good medical record keeping, because the primary sources of information for program indicators are generally the patient files and clinical and laboratory registers. Paper-only systems are increasingly being replaced by electronic systems, but it's important to remember that in clinics with small DRTB cohorts, paper-only systems can be more efficient, in particular if there are challenges with electricity or access to computers. When the paper is the only format available, case registers can also be considered tools for aggregation and analysis. As I'm sure you will have seen in DRTB registers, there is a spot to tally information at the bottom of each page, and this can help with generation of quarterly, monthly, weekly reports. To make a monitoring system work, we need to speak the same language across the entire process, which means that we need standard definitions and indicators, and that the information required to calculate these indicators needs to be available in the primary sources of information and in the aggregation tools. And it needs to be there in a way that can be easily extracted. Another key element to monitoring is the monitoring feedback loop. It's important for clinicians and facility managers, in addition to project, district, and country coordinators, to review the data on a regular basis and to use this information to inform practice. While the information required by different stakeholders may take different forms, and sometimes routine reviews of the data will trigger additional analyses or file audits in order to enhance a deeper understanding of what is happening, the first step is bringing everyone together and using the same language to look critically at the data.